Welcome back to your Real Health Connection podcast. I'm Shauna Ryan, and we're so happy to have you with us today, listener. We're going to be talking about a pretty in-depth topic today here at Real Health, and that is Mental Health Awareness Month, as well as talking about alcohol use disorders. And we've got our one of our regional experts here with us today, Dennis Gade. He is a licensed clinical social worker here at Real Health Inc. Dennis, thank you so much for taking time out of your very, very busy day to talk with me today. I appreciate it.
Thanks for having me.
And, I kind of shortened your title quite
That's
a bit
fine.
there. Tell us who you are here, what you do, and give us that nice long title that we talked about before.
Yeah, so I got a lot of letters here because we're all about acronyms and human services. But like you said, I'm a LCSW, a licensed clinical social worker.
Mhm.
I'm also what they call a CADC. It's a certified alcohol and drug counselor it's just for the state of Illinois.
Okay.
But yep, that's me in a nutshell.
Oh my goodness. So how long have you been with Rural Health?
I'm hitting 5 years now with Rural Health. Actually, it'll be December of this year. It'll be 5 years here. So,
Okay. So you've
um,
seen a lot over the last few years in terms of mental health in our region and substance use and abuse in our region. So yeah, that's why we wanted to have you on today. Um, Now, before we dive into our topic for today, tell us a little bit about what you do here.
so here primarily we're doing mental health, basically outpatient counseling. Um, Pretty much kind of a little bit of everything. We see some drug addiction. We see lots of what I would call severe mental illness. Also, just kind of a lot of anxiety, depression, post traumatic stress disorder, things of that nature. So we kind of run the gambit here. We kind of cover a little bit of everything. So yeah, mostly on an outpatient individual counseling basis.
Okay. So do patients have to have a referral
They
for
do.
care here? They do.
Mhm. They
Okay.
do. Yep. They're not usually too difficult to get. They just establish with primary care or behavioral health, and then they can get a referral to pretty well anywhere within rural health,
Uh-huh.
and that includes us. So
Okay. And at what age do you start seeing patients?
we are 18 and up here. We don't see anybody under the age of 18. We're just not licensed and set up for that. So we see 18 and above.
So for those who are younger then, do you work closely with other providers throughout our region, other agencies and organizations to get them that care?
We do, yep. Centerstone's a big partner. Arrowleaf, of course, is a big one too. Shawnee Health, Gateway, all the different places in the region, depending on what the client's needs are. If it's more addiction related, it might be Gateway or Centerstone. If it's more mental health, it might be Arrowleaf, something like that. So,
Okay. Okay, that's great. So you've got a lot of resources that folks can turn to for additional support.
mhm.
Even for those who might be over 18, you do have that additional support available to
Yes,
them. So
yep.
that's exciting.
Also, other places they may offer a little more than we like groups or like group therapy, something like that. Stuff
Sure.
that we don't have a lot of here. There might be other options for that too. So we work with the other providers to kind of get people where they want or need to go. So,
Great. So the starting point would just be with the individual's healthcare provider, and that could
mhm.
even be healthcare providers here at Rural Health, right?
Right. Yep, definitely.
Yeah,
Definitely.
because we do
Yep.
have
They just
doctors.
need to be seen, kind of we do kind of a little evaluation, kind of see
Yes.
what the needs are, and then we kind of either we can refer in or refer out depending on what they need. So,
Oh, that's exciting. That is exciting. Well, a lot, you do a lot here every day. I know that you're busy and going and talking with people and working with all these agencies. Um, let's go ahead and talk about something that we've been concerned about over the last couple of months, and that's alcohol use disorder.
mhm.
We're right now. It's listener. You may be listening to this in May. If not, if you're listening to it at another time, that's fine. May is Mental Health Awareness Month, so we are wanting to focus on this particular topic and make sure that we get that information out. So before we dive into it too much, exactly what is alcohol use disorder, and does it go by other names? What might people recognize that as?
Yeah, you'll probably hear it referred to a lot of different things: alcohol abuse, alcohol addiction. Of course, you'll kind of hear the less flavorful terms for it, addict or drunk, things like that. But typically in this, we're talking about alcohol use disorder or more vaguely, we could lump it in under substance use disorder, you know.
Okay, so how is it different from alcoholism, or is that the same thing?
Well, they're a little bit different. Abuse is really more kind of a pattern of unhealthy drinking, but it hasn't led to those serious consequences yet. Um, Really, what we're looking at, and I try to hammer this point home with pretty well everybody that comes in, is you do not have to drink every day to have an alcohol issue. I hear that quite a bit where they're like, well, Dennis, I can't have an alcohol issue because I don't drink every day. Or a big one is I go to work every day, I pay my light bill, I do those things. Those people might be kind of more under the abuse category. When we get into addiction, it's when it starts to affect all those things that I just mentioned in a negative way. You might stop paying your bills. You might be struggling at work. You might be avoiding other obligations. There's cravings. There's, trying to stop but can't, or cut down but can't. So it's, if I could sum it up, it's the difference is abuse, we're still kind of in control a little bit,
Uh-huh.
whereas addiction, we're really not at that point.
So when we get to the addiction level is when we really want people to come in and start seeking that treatment. Or are you
Well,
looking?
I would make the argument at the abuse, we want to try to get people in as much as possible because it's
Okay.
such a slippery slope, and if we can interrupt that cycle earlier,
Hmm.
we tend to see better outcomes that way. The truth is, once we get to an addiction stage, not that it's not possible to do, but it's much more difficult to do
Hmm.
treatment at that point.
Okay.
So
Oh, very good. Okay. So,
earlier intervention, the better. I mean,
uh,
most people, to be honest though, most people don't show up in treatment until it becomes an addiction issue. But we like to try to get people in if we can in the abuse stage of things or
okay.
misuse stage of things. So
And that's smart. Yeah, that makes a whole lot more sense than what I was thinking. You want to get them in there before it becomes too big of an issue, so
right.
it doesn't become too big of an issue.
In a perfect world, yes,
Yeah.
but unfortunately, most people don't realize that it's an issue until it becomes an addiction, right? Because of those other, I'm going to work, I'm paying my mortgage, I'm doing the things, right? But maybe abusing alcohol is part of that for them too. So.
Okay. So what are some other signs and symptoms then of alcohol abuse or addiction that people need to be aware of?
So lots of things that we kind of said. Cravings are a big one.
Mhm.
Failed attempts to stop or cut down. You could be looking at, neglecting obligations at home or at work. Continued consumption despite health issues. Legal issues. People that get maybe multiple DUIs or things like that. We could be looking at a substance use issue at that point. Basically, it's just continued use despite negative consequences if we really kind of wanted to sum it up.
Okay.
Um,
And that can, I can see when somebody reaches that level, they may not even be aware that it's a big deal, or they may just reach a point where they don't care or what have you. So it's important for others around them to say, look, this is something we need to get taken care of because it's affecting this, this, and this.
right, right.
So,
And typically, like I said, people kind of judge it based on, well, I'm still doing A, B, and C, right? I'm still going to
exactly.
work. I'm
Right.
still got the bills paid. I'm not,
Yeah.
sleeping under a bridge or something like that. And it's like, well, guys, we don't have to get to that point for it to be an issue, right?
Yeah. Yeah, have my good days and bad days. Good day,
Yeah.
I'm able to do what I need to do. So
Right.
you touched on health issues. What are some health issues associated with this?
Oh, alcohol has tons of health, heart issues, high blood pressure. Of course, people are familiar with like cirrhosis, liver issues. One that I think gets overlooked a lot, you'll hear it referred to as wet brain, Wernicke's disease. It's basically where your brain starts to, for lack of a better way to put it, kind of turn to mush because you've drinking too much alcohol. Um,
Really?
yeah, it's I wouldn't say it's super common, but it's not unheard of either. That would be years of heavy drinking. It wouldn't be somebody that's casually drinking, but that's one that gets overlooked a lot. Of course, diabetes, heart issues, kind of all of the above. Alcohol causes a lot of health problems. It's a big cause of health issues for sure.
Oh my goodness. So, I mean, and we know that alcohol attributes to cancer and all the things
Right.
that you mentioned. We understand that. Um, so when you're looking at someone who's going through these types of things, um, who are we seeing in our region? I mean, what typically are the demographics of those that misuse and use alcohol? What are we seeing there?
Um, so in our region, and probably this is true mostly nationwide, well, it tends to be higher in men. Um,
Okay.
Mostly kind of the younger crowd, maybe between about the ages of 18 to 30, somewhere in that 35, maybe somewhere in that realm of thing.
Hmm.
An interesting point, though, is while that's the highest demographic that uses alcohol, the highest demographic that has issues and potentially dies from alcohol use is people in the 40 to 65-year-old range.
Okay.
Um, because usually by that point, you've been drinking for 20 years and the health problems start to show up at that point, you know? So, um, and one other thing to mention, like Native Americans tend to have a higher alcohol use disorder, and veterans as well. We see a lot of that too. Um, Alcohol abuse and drug abuse is high amongst veterans as well.
Oh,
So
goodness. Well, and we know that in our region, we see a high level because of, may have an inability to have a job or whatever the case
mhm.
may be. So, do you see our part of the country as being kind of like a hot spot for this
Yes,
because we tend to have more going on with us through here?
yes, actually, and an interesting factoid: the DEA has actually listed our entire region, basically from St. Louis south, and it covers kind of the 3 or 4 state area there, like Missouri Boot Heel, Kentucky, Indiana, stuff like that, as a hot spot or a high risk area, right? It tends to be linked to several things. It's poverty is a big one. Lower incomes, lower educations, higher points of like jobs that are physically demanding, construction work, tree trimming, farming is a big one, things like that. And in rural areas, it tends to be more of a cultural thing. If you've ever listened to any country song, it'll tell drinking beer and farming go hand in hand, right? So it's just kind of a cult. You work hard all day, and what do? You go to the bar with some friends and tie a few on, So it's very much a cultural thing as well. Not that it's not in rural areas, but it seems to be a little more of a cultural thing in rural areas for sure.
Right. Yeah. Alcohol tends to go along with celebrations and that, yeah, if you've got
Baseball
somebody,
games and whatever, right?
right, if you've got somebody that's got an issue already, that just makes it even worse. So,
Right.
and yeah, it's something to consider there.
Right.
Now, as far as, we've talked about how common it is. We've talked about how, the causes. What are some of the treatments available to someone who is going through alcohol abuse, addiction, what have you? What are some things we offer here at Rural Health?
Well, rural health, we do mostly outpatient stuff. So it'd be individual counseling. We can focus on kind of more mental health, what we call CBT, cognitive behavioral, meaning we're looking at thoughts and feelings and how they kind of contribute to the choices that you make, right? But for overall the area, we could look at residential treatment if it's a really serious case. There's also medications that we can prescribe, like an antabuse or something like that, that makes you very, very sick if you drink
Mhm.
alcohol. So it's kind of a deterrent there, right? So there's a few options for that. But here at Rural Health, we do some medication, but mostly outpatient individual therapy for that.
Okay. Now, what would you say? I'm sorry about that. Trying to turn down my phone.
All
Uh,
good.
hey, that's part of working in an environment, right?
Right, right.
What would you say to someone who's concerned about someone else and helping them to get the care they need? What are your suggestions for that? What do you say?
As
I mean,
far as
say that
like
mom calls you and says, "Hey, I've got a concern about my kid." How do you, how
okay.
do you go about that?
Well, just to get them into treatment, you mean? Is that
Yeah.
yeah. I get those calls a lot. Unfortunately, there's unless it really is the patient that really wants to seek treatment, our options kind of get limited if they don't see it as an issue, if they don't see it as a problem.
Hmm.
One of the things I would say is don't confront them and be aggressive like you're doing this, you're doing that. That's going to turn them off, right? It's the best thing I could tell people is try to take a supportive approach. Try not to be confrontational, even though that can be hard because usually by the time you get to that point, it's causing issues, right? And it's caused a lot of issues within families and things like that too. So, kind of trying to kind of point out to them, hey, these are our concerns. This is what we're seeing. It's really hard with substance abuse and especially alcohol because most people they don't see it as an issue because of those other factors, right? I'm working, I'm doing my thing, and so I just like to have beers after work or whatever, and that's a really hard sell sometimes for people unless it's causing major issues there. So I would say maybe take a more supportive approach, not so much. If you ever watch that show Intervention, I don't know that I would do things like that necessarily because that can turn a lot of people away.
Well, and the thing that, we talked earlier about what are some of the primary causes that we see of someone who has an alcohol issue. We want people to know that this can happen to anybody. You don't have to be just of a certain socioeconomic status or
Right.
education level or what have you. It can happen to anybody at any time, right?
Anybody. I tell everybody if you have a functioning brain in your head, you are susceptible to addiction, and that's substances across the board, right? Alcohol is probably one of the easier ones because there's less stigma attached to it because it's so available. I could walk into any gas station in the area and buy pretty well whatever I want, right? So yeah, definitely that would be something to look out for too. Is there's just not the stigma attached to alcohol use that there is to other drugs, and so
Right,
it's just easier to fall into that, right?
right.
Plus
And
the
listener,
legality of it, right? Even people where
exactly.
if you worked for the government, let's say, and all the other drugs are illegal, but you can drink alcohol, well, there you go. you
Right,
know.
exactly. Yeah. And listener, we want you to understand as you're listening to this and you're thinking, well, I drink a beer on occasion. What's wrong with that? We're not judging you for making the decisions that you're making. What we want you to understand is that we are here to help you if it reaches a point to where there's no turning back for you, or if
Mhm.
it's impacting your life in a serious way. We want
Right.
you to know that Dennis and others who are here are available to help you through that if you're needing to do it. And there's no judgment in it. Like you said, there's usually stigma attached to having an alcohol abuse or an addiction issue. We don't show that here. We
Right.
we treat everybody equal and level, and as we like to say here, meet you where you are.
Yeah.
So, Dennis, I think that was important. Just we want people to realize this can happen to anybody.
Yeah, that's the big thing is there's no, we have populations that might be a little higher risk, sure, but I have worked with people across the spectrum, economically, regionally, it crosses racial lines, gender, all that. It does not matter. I have seen across the board. I've seen people that made seven figures a year. I've seen people that had nothing. It's and
Yeah,
everybody in between, right? So
exactly.
yeah, it
And
really does not discriminate. It really does not. So
right. Yeah. So listener, if you're reaching that point of no return, we're here. We can help you with that. And we'll get you through that if you're not able to make it through on your own. Dennis, is there anything else you would like to talk about on that particular topic?
yeah, I think to touch on something that you said, like the listener that might be like, well, I drink a cake, I might go out to the bars on the weekends. I might have a few beers at home.
Yeah.
Keep one thing in mind: 90% of people roughly can drink socially or casually, and it's not an issue for them. The vast majority of people that do drink alcohol don't have an issue with it.
Right.
We don't have an exact number for that, but it's probably right around 10%, of people that actually develop an alcohol or substance use disorder. So there is definitely a difference between social and casual drinking and abuse or addiction, right? And so most people are not abusing alcohol, and even like your college kids, they might be abusing alcohol, but the vast majority of them don't become addicted to alcohol, right? And
Right.
so
Yeah.
it's a risk. Don't get me wrong; it's a risky thing, but it's not a guarantee. If you're like drinking a couple of beers, you'd be like, oh, I'm going to turn into get an alcohol disorder. Like, no, it's not quite like that. There's a lot of other factors that go into that too. So
So in my mind, and you can correct me if I'm wrong on this, in my mind, I see it. If you're just a social drinker, you can walk away. You
right,
can make
right,
that personal decision and physical decision to stop, and it
right,
doesn't impact you. For
right.
somebody who's reached that level to where it's become abuse, addiction, what have you, stopping is not an option.
Yeah,
Not
yeah.
not the not an easy option, I guess.
Exactly. It's typically characterized by loss of control, right? It's
Right.
loss of control. I told myself I was going to cut down or stop, and every time I try to, I find myself doing the exact same thing, right?
Mhm.
I break all the rules that I set for myself, and I might start, like I said, missing obligations, or work performance suffers. I'm spending all my money on it, something like that,
Sure.
right? So like I said, those are usually maybe about 10% of the cases. So
Yeah. Okay, good. Let's kind of switch gears for just a minute if we can, Dennis. And if we need to come back to this topic, we will. Um, but like we said, we are heading into May. Actually, it is May. When this comes out, this will
Yeah, I
be
was gonna
May.
say tomorrow's
It
May 1st,
starts,
weirdly enough.
yeah, tomorrow's May 1st. So we're heading into Mental Health Awareness Month. What is on your mind? What is on the mind of the behavioral providers here at Rural Health as we head into May?
As far as just like overall mental health, you
Overall,
mean? Or
yeah. What are some of your concerns that you're seeing for our region? What are some ways that you deal with mental health in our region? Some what are some things that you see? How can people get in touch with you? Just kind of the whole gamut there.
okay, okay. Well, the biggest thing I would say to anybody is mental health, as you have probably heard in the news or other things. It's on the rise across the board, right? Our area is not unique to that. We're seeing an increase in mental health and substance use disorders across the board. COVID was really a hard one for that. That
Yeah.
addiction and mental health issues really took off during COVID, and I think we've come down from that some, but we are not back to where we were pre-COVID. I can tell you that much. There's still a little bit of a holdover from that. The biggest things we're seeing is probably anxiety. Of course, is probably number one. Depression's not too far behind that. Of course, we're looking at like post-traumatic stress disorder is a big one. And then kind of get into the more severe, your bipolar and stuff like that. But the biggest ones I would say is anxiety, depression, and post-traumatic stress are probably the top three for me.
Are you seeing that as an increase from what we saw pre-COVID?
Depression and anxiety for sure.
Really? Okay.
Depression and anxiety for sure. It really spiked during COVID, and it's like I said, it's probably come down some, but I don't think we're back to baseline with that. I think it's kind of elevated still with that. Um, yeah, that's probably the biggest ones that we're seeing right now.
My concern right now is with that generation of teenagers that went through COVID and
Mm-hmm.
all that they dealt with. Are you seeing an increase in that following age group there?
Yeah, yeah, it's kind of the defining, like my generation was 9/11, right? And the
Right.
kids after me, they're generate COVID. COVID was kind of the defining moment of for their generation, I feel like.
Mhm.
So, yeah, we're still seeing quite a bit of that. And we're seeing kids that for lack of a better way to put it, don't have the social abilities that they once had. They sat at home on a computer for 2 years,
Yeah.
and when they went back to school, socializing was and interacting appropriately in social situations became a pretty big struggle for a
Hmm.
lot of kids after being at home for a year and a half, 2 years, so um
Yeah. Because they didn't have that outlet. They didn't have those people and resources that they were normally talking to and having those
right,
interconnections. Yeah,
right.
I can
And
see
it
that.
relates to mental health because that social situation, struggling socially can also lead to anxiety and depression, especially in the younger crowd. That tends to be, your teenagers and young adults. That tends to be a really, really big one. There's social anxiety.
Right. Exactly. Now, we do things like the podcast and we reach out with our media and stuff. But is Rural Health doing anything in extra, maybe in schools and in community settings to get people to get that age group and to help them or just anyone
I
in
know
general?
we've reached out to several schools in the area, kind of doing like a little, I would call it like an awareness thing, kind of, hey, kind of like what we're doing here, but more for high school kids or whatever. Hey, here's the dangers of this stuff. This is what happens if you drink too much alcohol. Smoking marijuana is a big thing now in the state of Illinois, like since it's legal, like those type, we kind of try to do some educational stuff, I would say. Um, but probably maybe we could do a little more outreach maybe because that's a big demographic of people to kind of target is the high school kids and early college age kids.
Yeah. I mean, and that is something we need to look at. I've made a little note. We're gonna try to work on that a little bit more because you mentioned we've got other agencies throughout our region that work well with the kids and do things with the kids. So we do have partners that we can reach out, and I'm sure they're all doing the same thing. They're all trying to get into those school districts or trying to get into the colleges and work it. I know it because I'm seeing them doing it, and I know we do
Mm-hmm.
it too. But like you said, there's just so much that we're still trying to navigate through, and those kids are still trying to adjust to. So,
Yeah, we're still
yeah,
playing catch up from a few years ago for sure. And
exactly.
to be honest, we
Exactly.
were kind of already behind the curve on that before COVID, so that really didn't help us a ton. uh,
Well, when you had something like COVID that kind of dropped in our laps, none of us were prepared for that.
yeah,
It's
yeah,
not like we were making plans for it a couple years ahead of time. It just,
right, exactly.
and
Yeah,
we were navigating through something that that folks alive today have never gone through. So
right,
to
exactly.
understand how
Yeah,
that works, yeah, that's just normal.
yeah.
Um, and so when it comes to receiving mental health support at Rural Health, again, does that come through doctor's referrals? Do we have patients that just walk in our doors and say, "Hey, I need something"? How does that process
It
work?
typically comes through doctors' referrals. We can get people that walk in, but they would have to walk in and establish and get either seen by behavioral health or primary care, and then they get a referral to us. So we're different in that regard. We're not I would say a traditional counseling agency because we don't take walk-ins or it's all
Okay.
kind of internal referrals. But somebody could walk in and say, "Hey, I want to get established." They see a primary care behavioral, and then they could come to us.
Okay. So they can come in and talk with one of our doctors or one of our staff that way, our providers, and that provider would do something of a needs assessment with them. Is
Pretty
that
well,
right?
yeah. A basic one, probably,
Okay.
yeah, and just kind of seeing, hey, are you concerned about your alcohol use, drug use, mental health, what are we kind of looking at here, and then based on that, they send their behavioral health or to us, sometimes both.
Okay. All right.
So
So listener, if you don't have a healthcare provider and you're looking for one, we do have them at Rural Health. But again, this could be a door for you to get in. And we have behavioral providers at each of our 5 clinics. Is that correct? Or at least
as
Tate?
far yes, I believe so. I'm
Okay.
not 100% sure about the Dongola clinic, but I think we do for the most
Right.
part. Yeah.
So
Um,
folks can definitely get referred in the region to the sites and go from there.
Right. And one thing to know, it's not so much alcohol, but if you're having like an opioid, if you're, struggling with an opioid use disorder or something, we do also do the MAR, you might hear it referred to, medication assisted treatment,
Mhm.
for like Suboxone and Subutex, Sublocade, things like that, for basically an opioid replacement therapy. Helps you get through the withdrawals, can kind of help you get
Sure.
into recovery just a little bit, right? So we
Exactly.
also offer that too. It's not so much for alcohol. Like I said, we've got a few things they can prescribe for alcohol use, but it's kind of more opioid based. But
Okay. All right. Very good. And listener, just so you know, we do have another podcast on the medication assisted treatment program. You can check that out with us as well. Okay. Very good. We've covered a lot of different things today. Dennis, is there anything else that you want to share that we've not discussed?
I think the big thing for me is if you feel like alcohol or other drugs might be an issue for you, the best advice I could give you right now is don't wait. These issues don't tend to get better on their own. Addiction is a lot of things, but it's progressive first and foremost, meaning it only goes one way, and that's up, right?
Mhm.
So if you're questioning it, if you're like, man, I just feel like maybe I drink a little too much, or a big one now is my marijuana consumption is maybe too high. That's a pretty popular one now. Don't wait, because that tends to just get worse over time. So reach out. Like I said, we're ready to roll if you need us. So
Very good. Well, Dennis, thank you so much for your time today. And I appreciate you chatting with me about
yeah.
this. This is a very important topic, I think, for our region.
Yeah, it's
Um,
huge. Yeah, it's a
yeah,
big issue for sure. We see a lot of it, and like I said, we're not unique in that regard. But
right.
unfortunately, here we have a little higher rates of that than maybe other parts of the country do. So
Okay. All right. Well, really good. Well, thank you again. And I'd like to get with you over the next year or so just to kind of see if we're seeing those numbers from COVID.
yeah,
Maybe we're seeing things go down. Hopefully we will. So we'll touch back on that maybe in a year or so and just kind of see where we are.
definitely.
But in the meantime, how can folks get in touch with you?
They can call here at the clinic. Me personally, I'm in Anna, Vienna, and Goreville, so I kind of split time between the three places.
Mhm.
They could always contact me directly, or you could just contact the main Anna number. And if you need to get in touch with a provider, you want to set something up, I would just call the main Anna number. But you can also call me directly or get in touch with us that way too. So,
Okay, very good. And just so you know, that number is 618-833-4471, 618-833-4471, and they will get you to Dennis.
yep. Or they'll send you to wherever they think
Wherever.
would be the best fit for you to get you
Exactly.
established with a primary care or something like that. So,
Exactly. All right. Got to have that starting point. That's great. Well, Dennis, thanks again. I
no
appreciate it.
problem. Thanks for having me.
Very good. Well, listener, thank you so much for joining us today and for this episode of Your Real Health Connection. It's so good to have you with us. If you'd like more information about alcohol use disorder or other services that we provide here at Real Health, just give us a call. Again, our number is 618-833-4471. You can also visit us online at realhealthinc.org. You can also check us out on Facebook, Instagram, and you can watch this podcast if if you're not watching it with us right now and you want to see what Dennis looks like, so you can get familiar with him. Just go ahead and visit our YouTube channel, and you'll be able to get to know him even a little bit better. But
Hopefully my voice didn't scare anybody away. So
no, Dennis, you are an awesome guy, so I don't see that being an issue at all.
I appreciate that. So.
I tell you what, you've got the personality for the job that you're doing, and I'm sure that your patients really appreciate it.
I hope so. We try to help in any way that we can, and hopefully we're making a dent in this stuff, I think. So
I think so. I think you're doing a fabulous job, and that's what you got to do. You just got to keep trucking at it, right?
that's it. One step at a time. So it's a tough sled out there for sure. I would say that much. It is the environment for drug and alcohol addiction is pretty higher at the moment. It's not an easy time out there for folks. So.
Well, you got to keep going where you can, and you're doing a great job. I know that
I appreciate that.
You really, really are. All right. Well, that's going to wrap up this episode. From all of us here at Real Health Incorporated, go out and make it a great day.